normal to have vaginal discharge?
Hello everyone, I am Dr. Archana Sarve. I am an obstetrician, gynecologist and IVF specialist. Vaginal discharge or leukorrhea or white discharge is a very commonly and routinely used term. So let's try to find out what is normal and what is abnormal. Vaginal discharge is made up of secretions from the glands in the vagina, dead cells in the vagina and the cervix. This discharge helps to clean the vagina and maintain the pH of the vagina. It is watery without any odor or without any itchiness, and the amount, color, odor and texture of the vaginal discharge varies with each individual, and it also depends on the which day of menstrual cycle you are. So when after a menstruation, like within next 5 to 6 days, it is very thin. During ovulation, at the time of the rupture of the follicle, that is at the time of egg release, it becomes thin, stretchy and clear. And after ovulation, it becomes thick and white. So these all are normal consistency of the vaginal discharge. So what is important here to understand is what is normal and what is abnormal. It also depends on your age, whether you have a pregnancy, whether you are breastfeeding, also if you are using any medications, any vaginal products. So now try to understand what is abnormal. Whenever there is increase in the amount, change in the color, change in the odor like foul smelling, there is a itchiness, there is a pain, there is a blood-stained discharge. These are all the abnormal signs of the vaginal discharge. In bacterial vaginosis, there is a foul-smelling discharge and there is a vaginal itching. So let's see one by one what all abnormal discharges can be. In candidiasis, which is a fungal infection, the vaginal discharge can be thick, cheesy, clumpy, and there will be lot of itching. In trichomoniasis, it will have a foul smell, fishy smell and associated with the itching and yellowish kind of a discharge. If there is a blood-stained discharge, the causes can be polyp, cervicitis or cancer. And if it is associated with fever, foul-smelling discharge, then it can also be a forgotten tampon. So repeated infection with all this kind of a fungal infection, bacterial infection or other things can lead to pelvic inflammatory disease, and which in turn can cause infertility. As we say, prevention is always better than cure. So try to do the things which can avoid these infections, and most important, consult a gynecologist if you find any kind of abnormal changes in your vaginal discharge. If you want to know how to maintain your intimate hygiene and how to care down there, please refer to our previous video. Thank you.
Lopmudra.